right now, someone we've certainly bombarded with questions since almost day one of all this. Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases and President Biden's chief medical advisor. Dr. Fauci, good evening. We learned today, so the first person to test positive for the Omicron variant in the U.S. was fully vaccinated with the Moderna vaccine, hadn't received a booster dose. A lot of folks out there are concerned about what this all could mean. So what is your message tonight? Do we know enough yet about Omicron to be specific about really anything?
No, actually, Anderson, we don't. I mean, having a single person who had what would be considered a breakthrough infection because the person was fully vaccinated doesn't really tell you much at all, because we have breakthrough infections with Delta, where people who've been vaccinated, fully vaccinated, very often, more often than not, they have mild illness. They don't go on to any serious consequence. From what we've heard from our colleagues at UCSF in San Francisco, that this person had mild symptoms and is actually improving. But it's only a single person, Anderson, so you really can't make a broad general statement or an extrapolation for what would go on with unvaccinated people or people who were boosted. So there's a lot still to be learned, and hopefully over the ensuing weeks, or maybe a few weeks, 2 to 3 weeks, we'll get a lot more information, mostly from our South African colleagues who've been really, really good in keeping us up to date on what's going on and being very transparent.
So you really think in 2 or 3 weeks we'll have enough more information from South Africa that can give us a better sense?
Yeah, well, one of the things that's going to happen in the next couple of weeks, Anderson, is that we're going to get the virus, which we have, and you grow the virus, or you make what's called a pseudovirus, which is a form of virus that you could work with in the test tube very easily. Then we're going to get sera from people who've recovered from COVID, as well as individuals who've been vaccinated and who've developed different types of antibodies to block the virus. And we'll see if, in fact, this particular virus is still sensitive to the antibodies that were induced by the vaccines that we're using. We expect, and I wouldn't be surprised if the level of protection diminishes somewhat, given the constellations of mutations that we see that would suggest immune evasion there. But you never know until A, you test it in an in vitro or test tube situation, but then you get into the real world data about what happens when a vaccinated person or a boosted person comes into contact and gets infected. These are all things that are unknown. We'll get the laboratory data in a couple of weeks, but we'll have to get the experience from our South African colleagues about what the real clinical effect is going to be.
Dr. Fauci, good evening. You just heard Caitlin Collins' report, probably talking about the fact that the president is going to be laying out a strategy on how to fight COVID this winter. Now, as his chief medical advisor, I'm curious, what are you telling him the most important thing to stress is to the country? And what, if any, policy changes do you think should be implemented? Caitlin, for example, mentioned the possibility of mask mandates now on public transportation as something that's being considered.
Well, Sanjay, as you know, I'm not going to get ahead of the president in the speech that he's going to give at our place at the NIH tomorrow. We're looking forward to that. But, you know, in the very, very constant interactions that I and the medical team have had with him over the last few days, we're emphasizing, and he's accepting very readily, the kinds of things that we're talking about, of making sure that the unvaccinated get vaccinated and that people who are fully vaccinated get their boosters as quickly as they possibly can if they are eligible. Because the question arises, you jump ahead of yourself and you say, well, is there going to be a variant-specific boost? And if so, should I wait to get that boost? And the answer is no. If you are eligible, namely if you've had the Moderna or the Pfizer and you're 6 months following your primary regimen of vaccination, or you're 2 months following J&J, don't wait. Get that extra boost now, because we know when you do that, the level of antibodies, as I think you already mentioned on the show, Sanjay, the level of antibodies that rise and go up following a boost is much, much higher than the peak level that you get after your second dose of a 2-dose vaccine. That's what you really want to see, because we know from our experience with Delta that even though the vaccine is not directed specifically at Delta, it's directed against the ancestral strain, the Wuhan strain. Yet when you get your levels of antibody high enough, you protect against Delta. That's where we're hoping we'll see with the Omicron variant, that if you get your levels high enough, it'll spill over and get cross protection against that variant.
Well, let's keep talking about immunity then and antibodies. You may remember, Dr. Fauci, back in September, we asked you about whether we should take into account the impact of natural or infection-acquired immunity when it comes to vaccination status. This continues to be an important topic for many people. I just want to remind you, take a listen to what you said back then on AC 360.
It is conceivable that you got infected, you're protected, but you may not be protected for an indefinite period of time. So I think that is something that we need to sit down and discuss seriously.
So that was, a couple months ago now, Dr. Fauci. Where do we stand on the idea of the protection that you get from having had COVID?
Well, there's no doubt, Sanjay, that if you are infected with SARS-CoV-2 and you recover, that you're going to have a significant degree of protection. What we don't know, because it hasn't been studied as precisely as the post-vaccination immunological response, that we don't know what the durability of is, what the level of is. And people who push back and say, well, wait a minute, are you saying that you don't get protection? No, you get a considerable degree of protection from getting infected and recovered. But the thing that we do know, that we're very sure of, that if you take an infected person who's recovered and then you vaccinate that person, that's the highest level of protection, both T cells, antibody, and all the immune parameters. It gets way, way higher than anything else. And that's the reason why the CDC continues to recommend that if you have been infected, that you subsequently get vaccinated for the optimal protection.
There's obviously, concern about Omicron in the last few days, but the Delta variant is still a very serious concern here in the United States. Michigan reporting at least 9 hospitals at 100% patient capacity. We've got the cold winter months now still ahead of us. How concerned are you about what is to come?
I'm glad you brought that up, Anderson, because we don't want people, because they hear of a single case of a new variant that just has now arrived in the United States, as well as what's going on in South Africa or in other countries throughout the world, to take our eye off the ball of the problem that we are facing right now. We are entering into a much colder season. We still have 99.9% of the isolates are Delta, and we know what we can do with Delta. We have within our capability to block it by getting the people who are unvaccinated vaccinated, and we still have about 60 million people who are eligible to be vaccinated who are not vaccinated, and to get those people who are already primarily vaccinated, fully vaccinated, to get them when they are eligible to get their booster for the reasons that I just said. And then we have other things, and you mentioned them just a bit ago, wearing proper masks when you're in an indoor congregate setting, getting the children vaccinated, that's really very important. We have 28 million children between the age of 5 and 11 who, if we get them vaccinated, will protect them for their own health as well as to prevent the further spread in the community. So there are a lot of things that we can do now with what we're dealing with now. And what we're dealing with now is Delta.
Dr. Fauci, I do want to get one audience question in before we go to the break. We're going to have plenty more after. But Sean from Virginia has a question about traveling for the holidays. Let's watch.
My family's planning on traveling to Europe this Christmas. We're all vaccinated, including our boosters, except for my son who's 13. He's not eligible yet for his booster. I'm wondering if it's safe to travel. I'm also a little nervous about last-minute travel restrictions. Should I be?
I think a lot of people are curious about this, Dr. Fauci. I know you were planning on getting together with your family this holiday season, fully vaccinated, without masks. Does Omicron change your thinking on this? What should other people be thinking?
No, again, thanks for the question, Sanjay, because I'm getting it asked a lot myself. I would not do anything different than we have been recommending all along, despite the fact that we have a case, and we likely will see more cases of Omicron as the weeks and the days go by. I would be surprised, I had already said it a little bit ago, that I wouldn't be surprised if we see a first case soon. But we just have a problem that's identifiable now. And just as I said, and I'll say it again, if you have a vaccinated situation, your family's vaccinated, enjoy the holidays indoor with your family in a family setting. Many of us will have to travel during the holidays. What you do when you travel, you take care, you're prudent. Travel always increases somewhat the risk of getting infected. But if you wear a mask, particularly when you're in an airport, in the congregate setting, you have to wear a mask when you get on the plane. And if you can, just get vaccinated as soon as you can. And right now's the time to get boosted. The children also, now's the time to get the 5 and 11-year-olds vaccinated so that as we get into those winter months and we approach the holidays, they'll at least be partially vaccinated.